maternity package. Okay? Maternity package, mas malaki ho ang bayad sa maternity clinic compared sa magpaanak sa hospital. There is also a reason for that. Okay? So there's this maternity package because maternity package, so part of it or the story behind it, it's anchored on the Millennium Development Goal, wherein it is part of the maternal and child care, which was a priority. And up to now, it's a priority. Kaya kinakailangan ho ng packages for that. So you have the maternity or the MCP. Okay? So, ang dami ho talagang may interesado sa MCP. Kasi nga, the goal was to change the behavior. When we first implemented that, okay, ang dami hong interesado. However, there was a catch. Okay? Kasi nga sabi ni DWH, meron tayong package na ganito. Mas malaki ang bayad. When we implemented it, okay, ang dami hong requirements. Kasi nga insurance. Okay? So those are just some of the many examples. Okay? COVID. Okay? When the pandemic started, COVID, okay, we're going to pay this, we're going to pay that. In fairness ho kay Philhealth, hindi si Philhealth ang nag-announce ng mga ganong bagay. Okay? So it was DOH or the media that's going to have this package. Okay? But I want you to understand, balikan nyo ho natin yung tip number 1, insurance yan. Okay? Ang dami hong mga requirements talaga. Okay? Kasi nga yung slide na pinakita ko, yun ho ang pagbabasihan. Hindi ho pinamimigay yung insurance. So kaya ho, be it kidney transplant, maternity care, CAP-MR, whatever illness, meron hong requirements. So at times, if you try to observe it, why is it that it is being publicized so much that it's like it's free, but when people will avail it, it's not free? Because it was never free in the first place. Okay? So there are things na, okay, kapag member kayo ng Philhealth, you can go to the hospital and ask for your benefit. Indirectly saying na wala kayong excess, which is actually not true. That is false. Probably for government hospitals, okay, for NHTS 4Ps, that could be one thing. But for hospitals who experienced otherwise, especially the private, 4Ps, NHTS, o poorest of the poor come to them and demand that, okay, they can avail free services. Sabi ng newspaper, sabi quoted by this and that. Okay? If you look for the source, alam na natin saan galing yung source. So again, pagdating ho kasi sa insurance, there's nothing free. Lalo na sa pag-execute ng private hospital sa rules ni Philhealth. Okay, there is always out of pocket. Okay? Now, I'll go back to the slide. Okay? I'll go back to the slide. Okay? I want you to bear in mind na meron ho talagang mismatch. Okay? Meron ho talagang mismatch. Kaya ho, babalik ka sa number 2. May mga inconsistencies. Bakit? Kasi nga, babalik ka sa number 1. Because from the very beginning, insurance si Philhealth. Okay? Now, in relation to the number 1, ito, a lot of hospitals say this to me, Doc Ben, mabuti pa ang DSWD. Mabuti pa ang PCSO, ang the Philippine Charity Sweepstakes. Buti pa ho yung lingap. Mabuti pa yung ganito, mabuti pa yung ganyan. Sabi ko sa kanila, why aren't you comparing a social health insurance to a charity organization, to a dole-out organization? Those are two different things. Okay? You're like comparing apple and oranges. Hindi ho talaga, Philhealth cannot function like DSWD. Okay? Kasi iba ho ang function nila, iba yung model nila. Philhealth cannot function as PCSO. Okay? Bakit mas madali kami yung makasingil ng payment sa PCSO? Well, definitely, kasi iba ho yung proseso nila. Bakit sa lingap, ganito lang yung requirement, binibigyan kami? Well, definitely ganun because yan ho ang design ng lingap. Now, for an insurance, it's going to be very, very different. Okay? So, I hope you got that. That's tip number 3.